right, everyone who came out from Barrington or Riverside, make some noise. All right. Well, we are happy to bring up a fellow anti-racist, feminist, member of both the House Health, Education, and Welfare Committee and the House Committee on Small Business, Barrington and Riverside. Here's your Rhode Island State Representative, Liana Kassar.
All right. Thank you for being here today, everybody. This is amazing. Give yourselves a round of applause. All right. I hope you're all feeling healthy today, and my heart goes out to anyone who's been struggling during this pandemic. We will make it through if we continue to stick together and we take care of each other. The pandemic has spurred tremendous economic crisis, disproportionately impacting women and people of color. There's more stress than ever, more mental health and behavioral health challenges, more strain on our relationships and our families and our stability. Barriers to reproductive health services and threats to abortion access only compound that stress. Access to abortion is a reproductive, economic, racial, and gender justice issue. We're here today because across the country there are threats to access to abortion and we can no longer stay silent. Most egregiously, Texas passed the restrictive and unconstitutional legislation, SB 8, as you've been hearing about, which has functionally halted abortion access for millions of Texans. Shame on Texas! Shame on Texas. People have mobilized across the country to respond to this difficult reality, but I'm here to talk to you today about what's happening in our own state. Rhode Islanders do have more access to abortion than Texans, but not all Rhode Islanders. In 2019, after years of dedication, hard work, and activism by many people, including many of you, I see so many of the signs that say, are we having to do this again? Yes, we're still having to do it again, but thank you for having been here with us all these years. So we passed the Rhode Island the Reproductive Privacy Act in the General Assembly, which codified Roe v. Wade into law. That guaranteed a right to abortion for Rhode Islanders no matter what the U.S. Supreme Court decides. However, we all know that a key to accessing any health service is whether or not it's covered by your insurance plans. Without coverage through insurance, people must pay for any procedure out of pocket. Unfortunately, the Reproductive Privacy Act did not guarantee access for Rhode Islanders with Medicaid or who are on state health insurance plans. My colleague, Senator Bridget Valverde, and I have introduced the Equality in Abortion Coverage Act over the past 2 years to eliminate these bans. So the Equality in Abortion Coverage Act has 2 main goals. It eliminates the bans on insurance coverage for people on Medicaid and people covered by state health insurance plans. So Medicaid Medicaid covers Rhode Island's most vulnerable populations, which includes a whopping 25% of Rhode Islanders, 77,000 people who are of childbearing age. Many of our lowest wage earners in Rhode Island are women of color who receive their health care benefits through Medicaid. Medicaid also covers people with disabilities and current and former foster youth. They deserve equal access to health care, including abortion, but structurally, by leaving people on Medicaid out of the Reproductive Privacy Act's protections, we created unequal access to care. Our state health employee plan covers about 32,000 Rhode Islanders. It's our state health plan. So that includes government employees, health professionals, college professors, students, and public servants who make our state run every day. They and their family members do not have abortion coverage in their insurance plans. The out-of-pocket cost of an abortion could consume a potentially catastrophic proportion of a month's income. In 2016, 75% of abortion patients in the United States were low income. Almost 50% earned incomes below the federal poverty level. Without coverage of abortion through Medicaid, we are setting families up for catastrophic economic impacts. Given that 60% of women who seek abortions already have at least one child, this legislation severely impacts our families. In Rhode Island, we pride ourselves. We pride ourselves in our sense of community, in our independence, and our respect for each other's beliefs. We treasure our families, and we fight for justice. Let's finish the work of the Reproductive Privacy Act. Let's trust people and their healthcare providers on their medical choices. And let them follow their own beliefs. And more importantly, let's remove the risk of financial hardship. So now more than ever, it's important for Rhode Island to pass the Equality and Abortion Coverage Act, clearly. So you're here and you're ready to take action. So here's 3 things you can do to donate your time, your talent, and your treasure to make a difference to get this bill passed. First, connect with any organization here so that you can stay informed. So there are some great advocacy organizations. Just go around to the tables. Please sign up for at least one so that when you walk away from here, you are on someone's mailing list so you know exactly what's happening with the Equality and Abortion Coverage Act for the rest until we get it passed. Second, donate to any organization that's doing the work. While most of our organizations depend on volunteers, and all of you are fabulous, I hope you're all volunteering, that's not enough. We need funds to support mailings and office space and everything to make this happen. And third, contact your state senator and your state representative and find out how they're planning to vote on this bill. And if they are not planning to vote the way you'd like them to vote, let them know that you are watching and that behind you there's 20 more of you and you will be watching in the next election. Thank you so much for being here. Thank you for being champions for reproductive justice.